Hello and welcome. You're watching India Fights Back and I'm Vishal Dahiya. Today we're going to talk about the exponential rise in COVID-19 cases in our country, various states specifically, which is obviously a cause of concern. We'll try and again understand the reasons behind this surge, also what is being done on the ground, what more needs to be done, and how concerned or how worried all of us should be here. Now, some facts first before we move on to the discussion. For the week ending 11th of February, there were on an average 10,988 new cases every day in the country, now the lowest since India's first peak in September. India has since then seen a spike in coronavirus cases over the past few weeks, with the daily rise staying above 30,000 since 18th of March. And in fact, in the last 24 hours, 59,118 new daily cases have been reported. Now, the first time that the daily cases count has breached the 50,000 figure was on 29th of July last year. Now, these figures themselves clearly point out to the severity of the situation and also the importance of our actions here. So we'll try and understand all aspects concerned. And for more on this, we're joined by a distinguished panel of experts. Let me first introduce them to you, beginning with Dr. Samiran Panda. He is a member of NEGVIC and head of the ECD division in ICMR New Delhi. And we're also joined by Dr. Sanjay Pujari, director of the Institute of Infectious Diseases, Pune, and a member of the National Task Force on COVID-19. Welcome, both of you, gentlemen. And let me begin with you, Dr. Sanjay Pujari, since you're in Pune and Maharashtra is one of the states where this surge is being witnessed. In fact, the only state where a significant number of cases are being reported every day. So we would like to understand the situation on the ground there in Maharashtra and obviously across the country as well. Your take on that.
Yeah, so we are currently witnessing a big surge in COVID-19 infections in Maharashtra. In at least a few districts, the surge has been very dramatic. And the place where I come from, Pune, has also, along with Mumbai, Thane, Nasik, and some parts of Nanded, Amravati, Akola, have seen a dramatic increase in the number of cases because of COVID-19. The hospitals are now getting stressed. We are getting patients in the hospitals. The bed situation is being very tight, and in this context, of course, this is an important problem that needs to be really tackled head on and develop some unique interventions really to try and control and mitigate the problem at this point of time. So yes, it's a little serious problem in Maharashtra, and I'm sure it is so in different states across the country as well.
Okay. We'll come to the specifics there as well, but let me bring in Dr. Samiran Panda here as well. Dr. Panda, breaching the 50,000 daily figure after 9 months and the lowest amount of time taken to reach the 1 lakh mark, that is just 5 days. That's during the entire duration of the COVID-19 pandemic in the country. Does this indicate to the fact that this is the second wave?
It is indeed a second wave. And when we talk about the second wave, of course, these figures are from some of the states. So the states are certainly witnessing a second wave of the epidemic of SARS-CoV-2 infection that causes COVID-19. And it's happening in a natural setting where the social life started coming back to its normalcy or in normal speed. So why did it happen? Naturally, it happened because the susceptible mass, they came in contact or in proximity with those who were infected, but not necessarily symptomatic or were sick. So from asymptomatic individuals, the infection got transmitted to those who were susceptible. And did the susceptible mass expect this to happen? Probably not, because who would knowingly take a risk of getting infected? So what could be playing a role behind this misreading of the epidemic? We have read in the print media and in the social media and different news media that the epidemic is over. So that's clearly a wrong statement. So the epidemic was not read well by some of the experts. And secondly, probably people started behaving in a manner that as if there is no epidemic, and so there was vulnerability. How can I say that there was vulnerability? The third national serological survey that was completed in January 2021, this year, that clearly showed that 75% of the Indians were not exposed and not infected to SARS-CoV-2, meaning 75% of the Indians were susceptible to be infected. So clearly, it is time, the evidence is right there staring at our face, saying that, look, the data says that we are yet vulnerable, so we need to find out ways to protect or prevent ourselves from getting infected. Now, if I go a little deeper in it, so I would say India, of course, is witnessing second wave. And in order to characterize some of the states more vividly and clearly, they are witnessing, and Pune being the city in Maharashtra, and Punjab, and Gujarat and Kerala. But then, is it the entire state, or it's there in a few districts? The analysis of the data clearly tells us that it's 60 to 70 districts where these are happening. So that actually, although at the face value looks like worrisome news, but that also indicates a window of opportunity. Okay. If we can have our efforts directed towards those districts, 60 or 70 districts, what is that? That is 10% of the total districts that we have in India. The total number of districts in India is 739. So 70 would be 10% of it. So if we move our efforts clearly, concentrating on those districts, 70 districts, we have the window of opportunity for containment.
Okay, definitely, and that's a very, very important aspect there, Dr. Panda, which you pointed out. There still exists a window of opportunity. We have not entirely ceded the ground to the virus. Obviously, there is a surge in the cases and worrying surge in various parts. But yes, we can still go back and contain this spread there. Let me bring in Dr. Pujari again here. Dr. Pujari, your views on the reasons behind this surge, because if you take the state of Maharashtra, then this has been happening for almost quite a few weeks now, the increase in numbers, and this has now become an exponential increase, and not only restricted to certain districts, but several districts now in the state.
Yeah, so there is not a single reason which may try to explain the surge. There may be multiple reasons. But actually, this is not different from what you see globally. Globally, you can see most of the developed world, including Europe and US, have had second waves after the first wave, and perhaps we are following through with the second wave similarly happening in various pockets across India. The reasons can be multiple. One of the first and most important is, of course, as Dr. Panda mentioned, a perception that as the figures went down because of the successful prevention intervention that we had during our first wave, thinking that the epidemic is over, and the media perhaps also coming out with information suggesting that the epidemic is over. But unfortunately or fortunately, we never really advised people to stop taking precautions. So somehow the fatigue associated with masking, social distancing, as well as perception that the epidemic is now on its low and perhaps will not come back, maybe one of the reasons. The second reason in Maharashtra, which maybe is that there have been an intensive surveillance, testing and tracing and isolation, all of these things going on, which perhaps got diluted as the epidemic cases went down. and that intensification which was there during the first wave got diluted, leading to this situation as well. The third problem, which is still under investigation, we don't know clearly the answers, but there are some signals there. It is whether we have a mutated strain of the virus which is more efficiently transmitted as compared to the virus which was circulating during the first wave. But having said that, even if it's a mutant viruses, the prevention tools that we have are the same. You need to have the masking, you need to do social distancing, you may need to maintain hand hygiene. So essentially, it's the same. So it looks like even if when you have an efficiently transmitting virus, you still need to take the same kind of precautions which you used to take during the first wave. Certainly, at this point of time, at least in my individual practice, we are seeing good or high secondary attack rates in families,
Okay.
which was not seen in the first wave. So there are multiple reasons for this, and you can't really pinpoint a particular reason of why the surge is happening. But I don't think it is surprising that if you look at the global trends, you usually see a surge after 2 to 3 weeks of the after 2 to 3 months after the first wave goes down, and that is because it takes 2 to 3 months for the virus to start circulating again when the population becomes lenient, and then increase gradually and exponentially to a population level where you can start detecting a surge.
Okay, okay. And what about Dr. Pujari? What about the mutants, the variation, the COVID-19 virus variations? Do these mutations also have a hand in the surge, or it's just that during this particular wave we're witnessing different kind of variants or mutations there?
Yeah, so virus always mutates, and you will find various kinds of mutations happening during the course of a pandemic or an epidemic. It's known across viruses. What is interesting is, again, I would go back to the global examples. If you look at the UK second wave, it was initially because of a mutant virus. You look at the South African second wave, it was because of the South African variant. And currently, you look at the Brazilian epidemic, which is actually very worse there, is happening because of a mutant in Brazil. So initially, you may see that these mutations constitute a small proportion of your total COVID-19 cases, but later on, you should be really looking for whether these mutations constitute a higher proportion of your COVID-19 patients driving the epidemic. But at least at this present point of time in India, we don't have that epidemiological link between the emergence of mutations and the surge. So at this point, we are unable to say so whether these mutants have led to the surge. But I think this is one of the reasons why we should be intensively investigating whether this is causing it. But again, having said that, we are not worried about mutants in the sense that prevention tools are the same. So whether it's a mutant or not, you need to take the same precautions. The only concern, and for which research will be there, is how the mutants are able to escape immunity, whether they are able to escape immunity, whether they cause severe disease. These are some of the things which are under investigation.
Okay, definitely. Those aspects will be much more clear based on scientific evidence. But as you said, Dr. Pujari, the preventive steps or the preventive mechanism is the same for the original virus as well as all mutations which we have witnessed or may witness in the future as well. Dr. Panda, I'd like to bring you in here on these two aspects, since Dr. Pujari mentioned, the global aspect as well. A bit of a comparative analysis if we do and try and understand, because there are other countries which have witnessed second wave, like the one which we are witnessing right now. What we can learn from that, and also the role of variants or the mutants here in the second wave.
All right. So here we are talking about three things. One, of course, as Dr. Pujari said, individual perception about the epidemic and how did that influence the behavior change in terms of the prevention or the protective behaviors getting maintained or not getting maintained. So that's an individual, and that's the host. the host for the virus is us, you and me, and everybody. And then we are talking about the agent, and the agent is the virus, and we are talking about the agent changing itself, and that's the mutant, the mutation. And why is it changing itself? Because it's trying to be more efficient in terms of going from one to another. Because a virus requires a living cell or a living organism for it to be proliferating. Because it doesn't have its own kitchen, in order to be able to have its metabolism and proliferation. So that's about the agent. But only existence of an agent and existence of a host doesn't make the transmission happening. The third factor is the environment. So I would focus on the environment, and environment is about human environment, the social environment, which is helping or facilitating the agent to go from one host to another. Now, in terms of the comparison, as you talked or asked about, in different countries, different social norms or behaviors exist. And so it will be guided by the group behavior. So it's not you and me or Dr. Pujari as an individual observing a protective or preventive behavior. If 70% or 80% of the people in a community or in a society observe protective behaviors, so actually the virus would not find a way out. So it's like multiple barriers created through the protective measures. And so what is important is a group norm or group behavior rather than as an individual behavior.
Community efforts.
Absolutely, and the community engagement. So it's community engagement which is the crux. We have to encourage the community. Now I go more relevant as the things are for our country. What are we seeing now? We are seeing election campaign, and the leaders are asking for votes to the community. So community has now a chance to decide, okay, this particular leader is asking for vote, but is he sending a message from that platform about not just the vote that will take him to the chair? Because if I do not observe protective measures, behaviors, mask in the rallies, election campaigns, then he might go to the chair, that leader might go to the chair that he is looking out for, but I will go to the hospital. Because in that mass gathering, my chance of getting infected will go up. So I can decide, okay, if I need a leader, so I want my leader to get the message. So this is about the mass gathering for political campaigns. Second, the mass gathering about or around the religious events. So there again, the religious leaders are well respected. They are, they are respected. They are listened to. So the mass or the common man or society listens to them. So a message going from the religious leaders will also have a great role to play. We have seen that in vaccination campaigns. Thirdly, it's about the social events like marriage ceremony. So that actually demands, community responsibility and sensitivity. Because I might have a Holi is coming. So I might have a very colorful and enjoyable Holi. And then for me, if the senior members in the family get infected, I'm not behaving like a responsible family member nor a responsible citizen. So the point I'm trying to make is it is the time we talk about the importance of avoiding mass gatherings. And if we need to go to a mass gathering, why it is important for us to observe mask mandate.
Okay. Indeed, community engagement and, the onus on the opinion makers in the community to go ahead and do their part here. That's really, really significant aspect, Dr. Panda, you're pointing out. Let's take a quick concluding comment from Dr. Pujari as well. Dr. Pujari, your views on what needs to be done here and now to ensure that the situation does not go out of control.
As the reasons for the surge are multifactorial, the interventions that we can do should be multifactorial. And one of the most important things, as Dr. Panda and you also mentioned, is community engagement. Each and individual in the community should take the responsibility of trying to not only protect themselves from COVID-19, but their near and dear ones whom they have a potential to get infected, passing the transmission on, particularly to their elder people in the family or households who have a higher risk of severe disease and mortality associated with this. That is, of course, community engagement. The second is testing, tracking, tracing, quarantining. This is very, very important, and healthcare system should gear up their surveillance and trying to track individuals, make sure that their contacts are traced, they are isolated or quarantined, so that further transmission, the chain of transmission can be tried to be controlled. The third and most important thing, of course, is the vaccine rollout, and this is something which is, I think, currently the most effective tool. Really, apart from the behavioral practices, because if we talk about vaccines, and if you look at studies, all the vaccines have 100% protection against severe COVID-19 illness. That is the key that the population has to get the message across. So even if you get a COVID-19 after a vaccine, you will just suffer from a mild disease or a moderate disease, but you will not have a need to get hospitalized or have a severe disease, hospitalized into a intensive care unit, etc. So when the evidence there is very clear that your vaccination is going to prevent severe disease, and perhaps there is some evidence now also to suggest that vaccines can prevent transmission as well, but leave apart that. But even for the benefit of not getting into the hospital with the COVID-19, I think the community should be very eager to really get into the rollout of the vaccine. And the government of India has done, I think, until yesterday, it was about 5.5 crores of vaccine doses given, at least one dose of the vaccine given. And we should also think respect that this is a dynamic field. So things go on changing. So if today it is 4 weeks, the new information comes in, there may be some delay in the second dose. So all of these kinds of things are adapted rapidly into the public health delivery systems. The government has done an excellent job. But as community, as you are talking about preventive behaviors, you should not only get yourself vaccinated if you fall into those categories that the currently rollout is happening, or if you know somebody, you should encourage them, or you should perhaps even facilitate making sure that these individuals, because vaccination is the key as far as prevention is concerned.
Okay, indeed, there it is. Thank you so much, Dr. Sanjay Pujari and Dr. Samiran Panda, for sharing your views and inputs on this very, very important aspect of the battle against COVID-19. We are at a very crucial juncture here. As our experts were pointing out, India is witnessing its second wave of COVID-19, which is obviously concentrated in certain districts in certain states, but the numbers are really, really significant there, and they clearly point out that we need to go ahead and take preventive measures, a multi-pronged approach, vaccination being one of them, and obviously the COVID-appropriate behavior, which our panelists were once again insisting upon that everybody should be following that. Before we leave, let us once again summarize the COVID-19 appropriate behavior for you. It is a simple 3-step process. All you need to do is ensure that you wear your mask at all times when you step out of your houses. Also, wash your hands regularly. Hand hygiene is really important, and follow physical distancing in public domain. Now, these 3 simple steps will go a long way in ensuring you and your near and dear ones stay safe and healthy, and everybody else who is. We'll come back again. Till then, keep watching Sunset Television. Thank you.